Welcome back, listeners, to Mosaic's Community Life Podcast, Life in Canada, episode 22. Thank you for taking the time to listen to our podcast today. My name is Jane Teasdale, and I'm one of the co-owners of Mosaic Home Care and Community Resource Center. Our organization focuses on person-centered care, social connection, and community. On the podcast today is my colleague, Lauren McNair, who works very closely with me. Some of you may have attended our programs and you would have seen Lauren in action. Welcome, Lauren.
Hi, Jane. Thanks so much for having me on the podcast today.
Can you just maybe talk just a tiny bit about your role at Mosaic, just so people understand what you do at Mosaic?
Yes, so I'm the Community Resource and Social Engagement Coordinator here at Mosaic, and I've been in this role for about 2 years. So I work on the community side of things, putting together our newsletter that has all of our social programs that keep older adults in the community socially connected. We release this newsletter 3 times a year, and it has all types of programs that are online and in person, ranging from workout sessions to art workshops, city tours, museum tours, interesting speakers, educational workshops, and so much more. I also help to collaborate on our activity booklet, which is releases every season and is filled with all types of activities that you can do at home or in the community around Toronto. These can both be found on our website, which is www.mosaichomecare.com, or you can always give us a call to get these materials as well. So I'm so glad to be a part of Mosaic, and I really appreciate my role here.
Well, we love having you and all the work that you've done over the years. It's truly amazing. And I think you're passionate about what you do, and that we really notice that as well. Before we begin, I would like to provide a bit more information about Mosaic as an organization, that we do provide home care, and we also provide, that community feel that we provide within our communities. Because I feel people need to have a clear understanding of what we provide, and that we're an integrated, person-centered model of home care, which is fundamentally different from the standard model of home care and home care franchises prevalent in our communities in Ontario, Canada, and the U.S. Mosaic Home Care Services and Community Resource Center was developed 14 years ago by the 2 co-owners, myself and Natalie Anderson, who actually deals with the operations side. So we really looked at the disconnect within the government organizations as well as the private organizations. So yes, we do provide home care. We do provide care for people with Alzheimer's, dementia, Parkinson's. Actually, we provide care for all ages in the GTA, and also keep people connected as well. We have a wonderful client services team, and they are in the engine room, and they are very skilled in what they're doing. It's not just a call-in service, I need a caregiver. It's actually they take the time and are passionate and have empathy and will listen to families and family caregivers and will try and figure out what their needs are. And, in the assessment, they certainly take their time in understanding about the whole person, not just about the medical needs, but about the community and social engagement and social connections as well. Mosaic's well-developed and integrated person-centered care processes color and shape what the person as a client and family experience. Our frontline care teams, many who have been with us for 10 years or more, and our client services similarly, and community engagement teams all the way up to senior management. The standard model is, however, typically task-orientated, siloed, and medically focused, emphasizing incapacity rather than intrinsic capacity. Much of the care today has little time for addressing social emotional needs, hobbies, interests, community, social connections, and human meaning, person to person. We believe it is a dangerous marketplace that assumes all care is the same, all care is basic, and with Mosaic, it certainly isn't. Differentiating the Mosaic model from the standard service model is becoming more and more difficult as more and more organizations incorporate person-centered care terminology in their communications, which they know nothing about. The other day, I overheard a healthcare professional commenting on how Mosaic was no different from any other care provider in the community, which was absolutely incorrect. The inference appeared to be that words were cheap. Fortunately, I was able to spend time explaining our differences and reversed his opinion. The moral of the story here is that perceptions of care quality should be evidence based. Informed choice of care is extremely important. So, families do have to ask questions when they're dealing with home care. And also making sure that the caregiver that you have has the proper training. There's a lot of issues with families hiring privately, cash under the table, no insurance, WSIB, all sorts of issues. So families really be diligent in doing the background checks and going with a very reputable organization that provides that communication, provides that oversight, provides that expertise, has a social worker and a nurse right in with client services. And certainly that's what Mosaic provides. So, Lauren, let's get back to your role now. This is what the whole topic was about. Why Mosaic implemented a role called Community Resource and Social Engagement Coordinator, which we call COSAC, almost 5 years ago. And why was this important? And I wanted to explain this to the listeners. So Mosaic implemented this role called the Community Resource and Social Engagement Coordinator 5 years ago as we saw a need within our model, connection to community, social engagement, and person-centered to have someone to lead our social programs in person and online at our Community Resource Center hub. Also, connect people to other community organizations interested in community asset and community building, and most importantly, collaboration with other organizations, be it private sector and not-for-profit sector, working together in our communities. And definitely Lauren has really learned that. And, over the 2 years that she's worked with us, she's just amazing in the way that she works with the community and with other organizations as well. So it is a learning process that we're going through together as an organization as well with Lauren as part of our team. So back to you, Lauren. So can we hear about your role, coming from your own words, and how your role has evolved over time?
Yeah, so as we know, there's so many aspects to aging well. There's the medical needs a person may have, but it's also really important to stay socially engaged and connected in your community. So my role is a big part of that, of connecting community members to other folks in the community, other programs, and other organizations. So I have the pleasure of facilitating a lot of these programs and seeing folks from the community come in and create these friendships and have that social connection because maybe they're feeling a little bit isolated, or maybe they don't have family or friends nearby that they can connect to, but they can come to Mosaic and take part in our programs. And it's really amazing to get to be a part of that experience. And I'm also able to connect people to other organizations or resources or support that they may need at our Community Resource Center, which is in our community hub at Armor Heights Presbyterian Church. So people can phone in or come in person and they can be connected to other resources they might need, like financial supports or transportation services or other social programs and events going on in the city. So it's a really fulfilling role to be able to help connect those people and bring that side of health and wellness into our community.
Yeah, thank you for that, Lauren. I mean, our community hub, as you mentioned, which is at Armor Heights Church, we've been in that location for 3 years and definitely using the community asset of the church. And last year, I think, Lauren, we had about 780 people that through our online programs and in person visited. Family caregivers come in. We have resources from both the not-for-profit sector and the private sector. I do know that there's call-in lines like 211 and different information databases, but it's nice for people to connect in person. They can ask us questions and we can definitely, sort of guide them and provide them with resources to help them within the community as well. And Lauren, what do you enjoy within your role at Mosaic?
I find this role so fulfilling and being able to meet so many different people from different areas of the city, different walks of life, and hearing their stories and what their lives were like, and realizing how much we all have in common, whether it's me and them or them to each other. I get to see these friendship form through all of our programs and seeing people really have that connection and make these relationships in their community. And I find it really fulfilling to be able to help foster that and hopefully make a bit of a positive impact on someone's life. We really emphasize intergenerational connection at Mosaic. And as a younger person, it's really fulfilling to be able to have these meaningful conversations with older adults in our community and hear about their life stories, about what it was like when they grew up, their first jobs, their families, their relationships, and get that advice and that wisdom and realize how much we really have in common and just really enjoy my time. Work doesn't feel like work when you're connecting with the community and just making these beautiful friendships and connections that I really value. And it's just a wonderful experience at Mosaic to be able to do that.
And every day is a different day at Mosaic. It is a real hub. Especially when we have our programs on, and as Lauren mentioned, people connecting and so forth. I'd like to talk a little bit about the blue zones. And I think you've sort of looked at that. Can you explain that to our listeners a little bit?
Yeah, so I find the blue zones really interesting. And basically, these are 5 areas of the world where people have the highest life expectancy and the lowest rates of chronic disease. So researchers are really fascinated by these places and want to find out why these people are living so long and so healthy. Many of the population live past 100. So what are their secrets to this success? So there's 5 places in Japan, Italy, Costa Rica, Greece, and California. And researchers went in to study the diet and the lifestyle and see how maybe other places of the world can emulate their success as well. So, one of the first findings was that they noticed the diet was a big impact. So, most of these places ate a Mediterranean style diet. So, that included a lot of plant-based meals, fresh fruits and vegetables, fish, healthy fats, including olive oil, as well as red wine. So that was really interesting to see the diet had a big part in that. A lot of just whole, real food. That was also quite delicious. And then they looked at some of the lifestyle factors. And the common thread through all of these different regions all around the world was that these communities had really tight social networks. All of the people there talk to their friends, talk to their neighbors. They would meet up in these social groups and really stay connected through all of those years. And that was really important to create that social fabric in those communities where people could rely on each other and help each other out. And it really had a sense of strong community. Folks in that area also tended to work a lot into their older years. So they would have jobs and they would stay active, which helped them not only physically, but mentally as well. There was actually one blue zone in Nicoya, Costa Rica, which has the term plan de vida, which is a sense of life purpose. And that really was a strong sense through all of these communities that having that purpose and having those social connections really increased that vitality in those areas and might be the secret to success to living healthier and living longer. So it's a really interesting topic. There's so much research on it and more emerging as people are finding out all of these commonalities through these areas. And if you wanted to learn more, there's a documentary out on Netflix right now called Live to 100: Secrets of the Blue Zones. And it's super interesting to hear about all of these amazing communities and the people that live there.
I like how you highlighted purpose, and I think that's a big thing with older persons to have that purpose, and to volunteer within the communities as well. So we do have people that have volunteered at Mosaic, and they love taking part and being part of a social network as well. Lauren has done some traveling as well as myself. Lauren's been to Spain and Australia, and I've been to areas in France and in the UK, and I think when we go on our travels, we always look at community space, how it's used, age-friendly communities. So we're always looking at that. So I guess we continue on working even though we're supposed to be relaxing. And one of the things really that I noticed in France is, and also in the European countries, is that there's open spaces and where people are coming together in the city. And that's even in the nighttime. Children are coming out, older persons are coming out, music is being played. It's just a nice atmosphere. People are sitting and talking together. So there's almost this what I call is a Bordeaux hum in some of the places where people are sort of having that conversation, but they're not speaking loudly that, the next person can actually hear the conversation. So it's just a lovely space. And, to be able to walk around walkable communities, pedestrian friendly communities. When Lauren goes out and does presentations, that's what, she's talking about as well. Enough places for people to sit, and also washrooms around. Toronto, you want people to get out. Where are the washrooms that older people can use? So, Lauren, just back to some of our programs that we do. What programs or work do you think Mosaic is good at in fostering social connection, togetherness, and community? So maybe you can highlight just some of these programs.
Yeah, Mosaic has so many programs that have fostered so much community connection and friendships over the years. The first one that comes to mind is our knitting group, which Jane, you can speak to because it's been meeting for I think 13 or 14 years now.
Exactly, yes.
Yeah, so
Uh,
they still continue to meet online and then also in person at Hillcrest Library. And the friendships there are so strong, and it's really been beautiful to see.
Yes, and it actually started at the Shops on Steeles where we started Mosaic, and a lady volunteered for many, many years. She, sadly, she's no longer with us, but she was the one that spearheaded that. And so some of the people that were in that group still come today. And it was just wonderful to see, how relationships are formed, how people feel safe at Mosaic. They feel comfortable coming and speaking to Lauren and myself. Relationship building with professionals is extremely important to build that. And then people do trust you, either for gathering information or just to have a meaningful conversation. So I think with the groups, with the knitting group, what we found is people are connecting outside of Mosaic. So they're going for their holiday festivities or going for lunch or actually helping one another. So if somebody is not well, they gather around and they're going grocery shopping for each other. So that, I think, is a wonderful example how social connection and social togetherness is being formed at Mosaic.
Yeah, it's been really beautiful to see and the new people that join in as well and are just so accepted into that in that group, and it's a really wonderful program to be a part of. And then also we have our weekly dance fitness program that is facilitated by Jennifer Hicks, and we've been hosting that once a week in person for I think about 2 years now, and it's been beautiful to see the friendships form. We so it's an hour of dance fitness with great music and great moves, and then we move over into our resource center for some coffee and some snacks and for a little bit of that socialization. And it's been so amazing to see from the very beginning when people were just saying hi, getting to know each other's names, to now these friendships that have formed and people carpooling together, walking to the class together, or doing other activities outside of Mosaic together. And we get to connect, we get to share stories, the good times, the bad times, and really facilitate this close knit group of connection of people who just want to connect to each other and have that thing to look forward to every week. So it's been a fantastic program, and it's been amazing to see the conversations and the friendships that have been formed through that program.
Yes, and I think that's our favorite time of the day as well, is after the program and people are coming together and we're having a coffee or sharing snack. And it's just a lovely time that I really look forward to each time. Go
Yeah,
on,
we
Lauren.
always look forward to our Monday mornings with the dance class. And then this is in person, but we also notice that these connections can be facilitated online as well. So we have the Growing Wellness Cafe that's been a part of Mosaic for over a year now, but has been going since the start of COVID, facilitated by Emma Rooney and Victoria Muir Bercia. And they have facilitated this wonderful program surrounding nature and gardening and wellness, and they have usually about 40 to 50 people joining online from all across Canada. We have people from the West Coast to the East Coast coming on. And even though it's online and some of these people haven't never met face to face, they know each other's lives. They talk and they connect. They share their stories. They share their gardening tips and tricks. And it's just a wonderful program. And I think really proof that even through these online programs, which we know are so important, and that's why Mosaic has continued to implement online programming, you can still have these beautiful friendships and connections. And we've heard people's stories, their successes and their sadness and their vulnerabilities. And it's such an amazing community to be a part of. And just knowing that these facilitators and Mosaic in our community was able to facilitate that online as well as in person. It's really beautiful to see these connections and see the impacts that they're making on people's lives.
Exactly. Yeah, a
Mhm.
lot of great work, and we certainly put a lot of time into really thinking, about our programs and definitely our newsletter. Can you talk a little bit about TD Parks People and 880 Cities?
Yeah, so we are able to partner with a lot of wonderful organizations in the community that help us to activate some of these outdoor spaces. So last year we received the TD Parks People Grant, which allowed us to put on some free community programming in Toronto parks. So we partnered with Camp Sunshine on Wards Island, and we had this wonderful harvest festival on Toronto Islands. So people got to explore the island on golf cart tours, meet new friends, see the community garden and really see these beautiful spaces in Toronto and go into them and explore them and meet new people there. So that was really fantastic. I was also able to be a part of the Parks People Conference last year, which saw people from all different types of industries coming together, which just shows how many different people have a stake in our parks and our community spaces. And I heard from wonderful speakers, attended wonderful workshops, and even got to explore some of our city parks and shared spaces. So we did do a tour of the Toronto Islands, and I got to hear a little bit about the amazing history there, how that all worked, and the changes that have happened on the Toronto Islands. We also got to visit the Evergreen Brickworks and see the history there. The Evergreen Brickworks is also a space where we were able to host some community programming last year through their Community Spotlight program. So we hosted an intergenerational dance party which saw over 250 people come through our doors. And we had people of all ages dancing and singing and engaging together in a really fun afternoon. And bringing people to this other hidden gem in Toronto. Not many people know about the Brickworks and all of the amazing programs that they're doing there. So it's been a real pleasure to work with these organizations and have other organizations in the city really want to animate these spaces and work with organizations like Mosaic who know that we're doing great work in the community to bring people together and bring people out into these beautiful spaces that they can use and they can connect with.
Yeah, most definitely. I mean, the Brickworks is one of my favorite places, very eco-friendly, and certainly, they have pizza nights and movie nights and all sorts of things.
Mhm.
Mosaic is quite skilled at, I think, Lauren, in working with other community agencies, both not-for-profit and private. We really foster collaboration, and I think, moving forward, I think organizations shouldn't be so siloed. They're not going to be getting funding. They've worked on wonderful programs. Their funding can be cut. So how can we sustain sustainability of these wonderful programs from the not-for-profit organizations? Well, that's working and collaborating with many of the private organizations such as Mosaic. So we've done, worked with a lot of different organizations. NeighborLink certainly stands out, a taste of North York. And they also did a big community event in one of the parks in North York. So that brought the community together. And, we're providing different things or refreshments or sponsorships. And again, I think bringing our expertise in working with different organizations as well. And I think it is, really important to understand how the community works as well. And I think with Lauren going to, educational programs and webinars, this is only arming her with more information on how she can use it within Mosaic and in the future with other organizations that she may be working with. But it is important really to understand the community and how it works. So, Lauren, I'm going to shift the conversation now over to social prescribing, which is a new terminology used in Canada, I guess, and BC. It actually started in the UK in the early 90s. And it is getting traction here, and a lot of people still don't understand what social prescribing is. So I was wondering if you could explain that a little bit to our listeners.
Yeah, so like you mentioned, social prescribing is gaining a little bit more traction here in Canada, and it's something that people might have been doing without even realizing it. But essentially, it's a holistic approach to healthcare that brings together the social and the medical needs of someone and those models of health and wellness. It bridges that gap between clinical and social care through connecting people to other organizations and resources that might help with the social determinants of health. So we know a person might have some medical needs, but there's other determinants of their health that can affect them, including, housing, nutrition, social connection, education, and things like that. So with social prescribing, it encourages physicians and clients to go out and connect to other resources that can help them with those other things going on in their lives. So a doctor may prescribe a green prescription or a nature prescription, which is something that's really taken off in Canada since we have so much beautiful nature and greenery and parks. So doctors can actually prescribe time in nature, or they can give out park passes to our Canadian parks and encourage folks to spend time in nature. And that's been proven to really help with things like depression or anxiety. And there's so many different examples of social prescriptions, whether that's connecting to educational resources or social groups or different counseling avenues. We were actually at a conference, which we'll talk about soon, and I heard a great example of, there's really long wait lists for some counseling
Yeah.
resources, and what do people do while they're waiting for that? So some folks were able to connect people to a social group, a social support group. So while they were waiting a few months for that session with the counselor, they were still able to get some of that support from their peers. And so they had even better outcomes when they eventually did reach their top of the list when they were able to see a counselor. And that's just one example of many of connecting people to other organizations and resources then can help alleviate some of the pressure that we put on our medical system and our healthcare system. So it's a really fantastic movement that is really taking off and gaining a lot of traction and being talked about a lot more because we know there's so many benefits, not only to the individual, but to our healthcare system as a whole.
Oh, that's a good explanation. Thank you for that. Yeah, because a lot of people still, well, what is it? And even healthcare professionals don't really understand. And definitely social workers have been doing that in their role. I would like to say too that Mosaic spends time in also going on a lot of webinars and learning. We as an organization, we don't stay stagnant. So we are part of the movement for social prescribing and attend the Alliance for Healthier Communities. It's probably every couple of months that we're going online. So we're continuously learning, myself and Lauren. So, Lauren, just getting into your role, what have you accomplished within Mosaic model, I guess, with the social prescribing? So, you've done some certificates, I think, with
Yeah,
regards to that.
so I was able to get my certificate in social prescribing through the World Health Organization open courses. So this allowed me to learn about what social prescribing is, how to implement it, and specifically what my role is as a link worker. So my role at Mosaic in my COSAC position is an example of a link worker. So this is anyone in the community, like a social worker or another person at a community agency that connects people to these resources that they might need and implement social prescribing. So through that course, I was able to learn what a link worker is, what I can do, how I can best apply this in my day-to-day duties, and really how to increase the knowledge in social prescribing and how to help our community members through that. And like it says in the name, a link worker links people. So we do that every day at our community resource center. And when people come to me asking for, a day program for their parent or, different transportation services if they're coming out of the hospital, I'm able to do that and connect them. And it's an example of social prescribing and how Mosaic is really implementing that in our model of care.
That's right. And, I think as well, Lauren, I think, it's the way that Mosaic is doing things and people feel comfortable in
Mhm.
asking us different questions. And so relationship building, uh, I can't stress this any differently, but that is definitely key in getting people to talk and finding out what their needs are and how we can help them. And Mosaic can't do everything, so we do have to connect, and we do have to stay on top of the community agencies and private organizations and what they're offering either at home or in the community. So, in fact, Lauren and I are still recovering from the 2-day conference, which was absolutely amazing. Co-designing the future of primary health care conference, and that was organized by Alliance for Healthier Communities. We actually had a table at this event, and we kept it very holistic in providing our information. Lauren, do you want to talk about our table a little bit?
Yeah, we always have lots of fun setting up our tables for these conferences and events. And lots of people like to comment on how much greenery and how much color and different things are on our table because we really like it to reflect what we do every day as an organization and all of the amazing social community programs that we have. We don't just have our newsletter and some brochures on there. We really want it to show what we do. So we add a lot of greenery, herbs, and things like that to reflect our connection to nature and all that we do on that side. So we do a lot of things with Emma Rooney with forest bathing, herb workshops, the Growing Wellness Cafe. So that's reflected on our table. We have a twiddle muff, which is something that our knitting group has made. And we've actually collaborated with the youth group at Armor Heights to create and donate to the hospitals to their geriatric programs or their emergency rooms for folks living with dementia. And that's on there. So it really draws people in to be like, what's this? Why is this on there? And then we get the opportunity to describe all of the amazing things that Mosaic gets to do and how that enhances our sense of community and our social programs. So it's always lots of fun. And I have to say, we do get a lot of compliments on our tables.
We do. And, most of the organizations, yes, as you said, it's just a brochure and newsletter. So how are they person-centered? Yeah, it's so I must say that we're usually the one that has, a lot of wonderful information to help all different people in our communities. During the conference, there was one individual that really made an impression on me, and that was Cormac Russell, who is a social explorer and spoke on asset-based community development. And this is what Mosaic is doing at the grassroots level. We've been doing that for 14 years, is connecting to the community. We don't just say and use lip service that we are doing that. We are actually doing that. So it was really interesting in listening to him speak and covering some of the points that we find important as well. And one of the things that he did speak about is the importance of person-centered care, and I'll talk a little bit about that after. But it was amazing. And then Lauren also attended a workshop. Do you want to talk a little bit about that, Lauren?
Yeah, so I was able to attend one of the workshops that he hosted at the conference about asset-based community development and community animation. And it was a really impactful workshop. And what stuck with me the most was that he didn't just tell us, and here's the things that you have to learn. He taught us by doing it. So he made it really interactive, asked us questions, and used the power of storytelling. And that's what really stuck out to me. He said that community animation, it's not about going into a community and telling them what your agenda is and what you want to do to help them. It's about taking a step back and listening and learning through stories. So that really stuck out to me. And you start with what's strong, not what's wrong, is something that he said. So when you go into these communities, you want to hear from the people there. You want to see in your community, what do people have that can help us to reach our goals? What do they want? And so that was something that really stuck out through learning about community animation and can apply to what we do at Mosaic. And it's actually what we do here at Mosaic. We're always trying to connect with our community and have that relationship, as Jane mentioned, where people feel like they can talk to us and tell us what they want. So we have community focus groups, as well as we often put out surveys to our community members to hear from them. So what programs are they really liking? Maybe what's not working at Mosaic? And what do they want? At the end of the day, we want to put on programming that is going to be valued by the community and beneficial to them. So whether that's more daily social programming, maybe that's some more educational workshops, we want to hear from our community and be able to provide them with the change and the things that they need. So that was a really wonderful and powerful workshop. And hearing Cormac speak was definitely a highlight of the conference for me.
Yes, I think we're going to have to get his book as well. And he does have some online programs as well. So that might be something we could be interested in. So the other, I guess, Dr. Dominic Nowak, who also presented in a plenary learning session, who is president of OMA, assistant professor of U of T, Ontario Medical Association, Women's College Hospital, U of T. He spoke on social prescribing, applying social prescribing in diverse Ontario practice settings, offering practical strategies for addressing social needs and clinical changes. So again, he spoke about relationships, the importance of listening, empathy, communicating. I think that is all important. And definitely with the new docs, they need to be trained in this. Again, it's not about the medical lens. You're having to find out about the person, their interests, their hobbies, their likes, their dislikes, their, who's in their social group as well is really important. And then connecting them, or if you have a nurse or care navigator on your team, is connecting them back out to the community. One of the points that I made in the session is truly understanding person-centered care. I find that person-centered care is, you have to understand that in order to be able to do social prescribing. And it's not about just using the terminology person-centered care. It's actually layers and layers of work that you need to integrate within your organization and to become ethos and the way that you do things from the top of management right down to your personal support workers and your staff as well. So you have to keep on with the training. What is person-centered care? If you go to our website, we have loads of blogs on person-centered care. So listening to the professors from the UK, from the European Society for Person-Centered Healthcare, Professor Andrew Miles and Professor Ashbridge. So again, I can't stress enough the learnings of person-centered care within that model as well. Because if you don't understand the person, how are you going to be providing social prescribing? So, Lauren, there's lots of things coming down the pipe. We've talked about a lot of things in this call, but what is coming down the pipe for the rest of the summer and maybe leading into the fall?
Yeah, so we have lots coming up that we're planning for. So for the summer, we still have lots of online programs going, including our dance fitness and our functional fitness, as well as our growing wellness cafe that continues all throughout the summer. So I really encourage you to come online and join us for those programs. And yeah, we're starting to work on our fall planning. So I can give you a sneak peek. We're partnering with Camp Sunshine again to host another harvest festival on Wards Island this fall. We also have our friend Sheldon Parker coming back to talk about all things about living happily in retirement and having a great life. We're also transitioning our Movement Minds and Magic program online this fall. So stay tuned for more details on that because it's such a fantastic program hosted by Jennifer Hicks and Robin Gurton. And we're also planning to collaborate with Armor Heights Presbyterian Church for a really special holiday kickoff event. So be sure that you're signed up for our newsletter. You can do that by giving us a call or going to our website so that you can be the first to register for these programs and ensure that you get a spot at these wonderful events. And I also wanted to use this opportunity to call out to our community members or anyone listening and let us know if you have a special interest or hobby or talent or skill that you would like to show to Mosaic and have a program of your own. We always love hearing from our community members and highlighting them as well. So, we've had folks come on to talk about their travels or maybe a special skill, if they're singing, if they have a special hobby that they're really knowledgeable about. So anything and everything, please get in contact with me. I'd love to hear from you. You can reach me through my email, lauren@mosaichomecare.com, and maybe we can have you host a program at Mosaic.
Thanks for all those points, Lauren, and for asking people to definitely get in touch with us about our social programs, and also, again, about our home care services that we provide. We are skilled in what we do. We also provide care in retirement home and long-term care, also bedside sitting. So again, you can check our website out at www.mosaichomecare.com. I also wanted to make a comment. I know a lot of people receive our newsletters, hospital staff, geriatric care teams, nurse managers, professional practice leaders. But I think it is important for you to come out and see Mosaic in action. We can talk until we're blue in the face and the content that we send out and our blogs, but until you experience the feel of our community and speak to people that have come to Mosaic, only then will you truly understand our model on person-centered, integrated, and community care. At this time, I usually ask for a takeaway message from our guest, and I know Lauren works with us, but she is a guest on our show today. So, Lauren, what is your takeaway message?
My takeaway message for anyone listening would be to really get into your communities and stay socially connected, or help others stay socially connected. We know there's so many benefits to our health and to the health and vitality of our communities. So whether that's coming out to a Mosaic program or finding out what's happening in a community near you, or being that person to create something in your community, be a leader and make that change and encourage people to stay socially connected. It's a beautiful thing that can really transform communities. And I would really encourage everyone to really express that within themselves and the people around them.
Yeah, and on that note as well, I would like to encourage PSWs who are working with other organizations. Take a look at our newsletter. You don't have to be part of Mosaic to sign on. And, you may be dealing with clients that are at home that can't get out and socialize. Check our newsletter out. Look at the social programs we're providing. Check out our articles, which are written by many either academics or the wonderful community agencies that Mosaic collaborates with. So we're at the end of our show now. And again, I thank you for attending our podcast today. This is Jane Teasdale signing off. Mosaic's Community Life Podcast, Life in Canada. And we'll see you next time. Thank you.
Thanks, Jane.